And we are live.
Nice.
Yeah, and we're on time. So many times technology interferes with us and we wind up being, 5 or 10 minutes late. But people are so adaptable, they just roll with it.
Yeah, I think everybody has experienced sometime technology issues at one point anyway.
Everybody who's part of Rodney Habib and Dr. Karen Becker's Inside Scoop, sometimes they'll be delayed by an hour
Oh,
because,
well.
you know, them often they're in Canada or he's in Canada, she's in Arizona, and they're talking with somebody in another part of the world, and it's a challenge. But I see we have people
Fair.
coming on. Hi, Eric. How are you?
Hi, hi, Rick.
And Janet. Janet is one of my team members, picking up
Hi,
organ
Janet.
and horse feed. Good for you. Getting those errands done. Um, Janet, I was at the hotel, and Eric, I was at the hotel this morning, and I think it's going to be, for a change, will be the only event happening in that wing of the hotel. So we won't be tripping over other groups, and we're going to have plenty of space. I think everything is going to be really good this year, really good. So we're getting more people popping on. Let's see if you're on and you can hear me. Give me a thumbs up or let me know where you're coming from, or where you're watching from, I should say. I see Eric is watching on YouTube and Janet on Facebook. We're a multi-platform kind of team here.
Are we hosting it on another platform too, or Facebook and?
Two Facebook pages, the Healthy Dog Expo page and the Dr. Lori Koger page, and my YouTube
Okay,
channel. So
nice.
welcome everyone to another Facebook Live in support of the Healthy Dog Expo, coming up in 3 weeks, which is really scary. If you haven't got your tickets already, oh, Eric's from Denmark. Wow. If you haven't got your tickets
That's far.
already, hop over to healthydogexpo.com and grab them. My guest today is, and I hope I say this right, Dr. Christine Monaco.
Perfect.
Perfect. It.
You
From
said it perfectly.
Jope, which is Joy of Pets. I love that. How did
Correct.
you come up with that name?
Thank you. Well, very nice to be here with everybody, and thank you for asking this question, Lori. We actually, my partner and I, he's also a veterinarian, and we wanted to come up with a name that reflected what we were trying to achieve and kind of the human and dog, special bond. So it took us months to come up with it, but we felt like Joy of Pet really kind of illustrated how important dogs are in our lives.
Mm-hmm.
And we thought it was kind of, the perfect name for us because what we want to do is keep our dogs happy and healthy so that they can bring us humans a lot of joys too.
I love that. I love that. And it stands out and nobody else has it, which is
Not, we did a
challenge.
lot of research.
I bet. I bet. So your first product is really, I would use the term revolutionary, because when everybody thinks of joint support, we think of glucosamine, MSM, chondroitin. It becomes, those terms become synonymous in the dog and in the horse world. And your joint support product has no glucosamine, no chondroitin,
Nope.
and no
Mhm.
MSM. And yet we've got canine physical therapists raving about it. So tell me more. How
Yeah,
did it
so
come to be?
well, so we it's kind of a pretty long story, but I'm gonna do my best to keep it short. It started with my experience with my senior dog Pepsi, who had arthritis. That's when I was in vet school, so about 10 years ago. And I did a lot of research to find what was the best supplement that I could give Pepsi. And so I, reviewed a lot of the studies. Being in vet school, I also talked to a lot of people within the industry. And I was going through the studies. I was looking at what was on the market. I tried a lot of different ones, and most of them had glucosamine and chondroitin. And unfortunately, they didn't really help Pepsi until somebody mentioned. Actually, it was somebody, it was Jeremy, my business partner. He mentioned UC2 because it was a newer collagen that was starting to be used more and more in humans and dogs, also in horses. And he recommended that I tried it, and he showed me the studies behind it, which at the time, it's still few studies, but I thought it would be worth giving it a try. And I really saw the difference it made with Pepsi. So Pepsi had pretty severe arthritis. So we were giving him, NSAIDs, which are pain medication.
Mhm.
And we were trying to keep him really comfortable. And, we wanted to decrease the amount of NSAIDs we had to give because, as you know, that can have repercussion on the kidneys, on the liver, on the digestive system. And so when I added UC2, I actually was able to decrease the amount of these NSAIDs that we were giving him. And then I did, more research. I knew about curcumin and omega-3. So I kind of did like a home blend of these
Mhm.
ingredients. The dosing I used for Pepsi was similar to the one we have now in Jope. And that came from studies. So it was really about, using a scientific approach to help Pepsi. And then fast forward, now, basically Jeremy, my partner, and we both are veterinarians. I worked in the pharmaceutical industry for a while. I was a sales rep and I was going to see a lot of practices. And I noticed, like you mentioned, most of the supplements still had glucosamine and chondroitin, like 8 or 7 years after my whole experience with Pepsi. And then, so during the pandemic, my partner and I, we had a little bit more free time. We couldn't go out. And so we were like really passionate about creating a supplement that would really make a difference and that wouldn't be using glucosamine and chondroitin. So we used my experience with Pepsi, and that's how we decided to create Jope, hip and loin dog chew with UC2, curcumin, and omega-3s. So that's kind of in a, quick overview and background, and I can go into more detail as to the quantities, why these three active ingredients.
Yeah.
But that's how we ended up excluding MSM and
Right.
glucosamine and chondroitin.
Yeah, and I think, so many of us who are on the holistic, alternative, whatever you wanna call it, side of things, it starts with us, with our own dog, with a problem that we're battling, and your experience the same. So, let's talk about UC2. It's a collagen, correct? And it's
Yes, that's
from
correct.
is it from chicken, I believe, or do you use another source?
Yes. No, so it come from the chicken sternum, and the chickens, we get asked this question quite a bit, like where does those chicken come from? So they're actually raised for human consumption, but in a
Mhm.
very humane way. And so it's
Good.
kind of the, derivative from the human production industry that is then used to extract UC2, which stands for undenatured type 2 collagen.
And I love that these chickens were raised for their meat, but we're also using other parts of them. So,
Mm,
kind of honoring the animal. And that's the thing
exactly.
that's come together from a lot of my sponsors. We try to do things as ethically, as humanely, and completely as possible. Uh,
Mm, very
so
important.
it really is, in so many ways. So, the curcumin, I love your theme colors with the lovely yellow because I always think of my friend Rodney and his yellow fingers because he's always playing, making golden paste and such, and, playing in things. Um, how did you find you found that through various research articles, you said?
Yeah, so the approach we took, so I had done my research with Pepsi, but it was, kind of high level and I was juggling a lot of things. So when we decided to create a supplement that we would, sell to pet owners, other pet owners, and other dog parents who
Mhm.
really cared about their dogs, we wanted to be very thorough in our approach. So what we did is we actually scanned through PubMed, and we probably reviewed about 85 and more articles. So we really had a very systematic approach where what we did is we reviewed all the studies and then we classify them based on the quality of evidence. So, if it's a double placebo randomized study, for example, or a
Mhm.
meta analysis, is going to have more weight to it, the results, if they're positive, than if it's just, a field study with some dogs and not very controlled. So what we did is we reviewed all these studies, we classified them, and that's how we identified certain ingredients that had much more robust data behind them to support efficacy. And so that's how we chose the UC2, which I'm happy to tell you more about too, because it's not only a collagen, but it's actually very different from like hydrolyzed collagen. And it's also how we chose curcumin because the studies, the more recent study, are actually very encouraging about curcumin. Same in the human field. I think more and more people are aware of the benefit of curcumin. And
Mhm.
so, that's the reason that we chose it. It was for its efficacy and kind of a raising star in the supplement industry too, same as UC2.
Yeah, yeah. So tell us the difference between the hydrolyzed collagen and the undenatured. Um,
Yeah. So a lot of people think that collagen are all the same, but they're really not. So UC2, it's actually patented. It means that there's only one type of UC2, and it's produced by one specific company. So they have a certain way of producing it where they extract the type 2 collagen, which is naturally present in our bodies at the joint level. It takes it basically out of the chicken sternum and then it puts it into UC2, but it uses a low temperature process
mhm.
versus the hydrolyzed collagen. There's a lot of different company that produce it. It's heated, so they actually heat the cartilage, and the cartilage can come from bovine, it can come from any source of cartilage. And so it's going to kind of break down, and that's why it's called, denatured or hydrolyzed, because it's going to break down its molecular structure. And so for undenatured type 2 collagen, UC2, you need a few milligrams. So you need about 40 milligrams for a 50-pound dog. But on the other hand, hydrolyzed collagen, you're going to need like 2 to 4 grams in
Okay.
order for it to have benefits. And it's also very different in the mechanism of action. So UC2, it has a specific mechanism of action, which is called oral tolerance. Are you familiar with that,
No,
or?
no, explain.
Yeah, so oral tolerance is actually really cool. What happens is when a dog or a human eats UC2, it's going to go into the digestive system, and there's a specific area in the intestine that are called the Peyer's patches, which
Mhm.
are part of the lymphoid tissue. So lymphoid tissue, Lori, you probably know, but for the other people, it's basically part of the immune system. And so what happens there is that there's specific cells that recognize UC2, and then these cells are going to tell the body when they see undenatured type 2 collagen elsewhere in the body, meaning in the joints that are being destroyed by arthritis, is going to recognize it and is going to tell the body stop creating inflammation.
Right.
So where hydrolyzed collagen is only going to help kind of replace the collagen that's being broken, but not preventing inflammation, UC2 is going to prevent inflammation, creating a healthy environment for the joint to repair the cartilage. So it has kind of a dual mechanism of action, which is very different from hydrolyzed collagen or glucosamine and chondroitin and MSM. So that's why I could talk about it for hours and
Yeah,
geek
no,
out.
that
It's
is
really cool.
that is really cool. And, so many people suggest just getting regular collagen supplements like you might get off Amazon. And especially for cats or, dogs where you're trying to stack things so you can minimize your NSAIDs and such.
Yeah.
But they aren't saying get UC2. They're just, collagen peptides. And you're right, that's a band-aid, that's a patch.
Mm.
That's not the elegant approach that UC2 brings to the table. Um,
Yeah, I think UC2 has it's just basically like what I like about it is that it's really trying to make the body stronger and
mhm,
smarter, and
yeah,
helping it really, heal versus the other ones, like you said, it's somewhat putting a band-aid. And in the very early stages, like, before any signs, very early on, if you're giving a very high dose, it might be enough. But I think UC2 just is much more beneficial from a health standpoint, even if you start it really early. Because, even in a young dog, and I think we have this question actually in
yes,
the questions. So in young dogs, what happens is kind of like us, when you're moving around, there are micro trauma happening at the joint level. And these repetitive micro trauma can actually create kind of an environment that's inflammatory and predisposed to joint disease down the road. So if you're giving UC2, you're kind of tackling upfront that inflammation and helping the joints stay healthy, which can delay the moment where you're going to start seeing signs.
Interesting. Yeah, and,
Mm,
I think for me, my high-risk dogs, the large breeds, the active dogs, the agility dogs, I wanna start them on joint support literally as six-month-old puppies.
yeah.
How early can you start with Jope?
So you can
So
start it as early as 6 months. Yeah, we actually tested it on puppies, just to see, how, if it was well tolerated, what would be the digestive symptom or anything, and they were very well tolerated. So another reason you can give it really early on is it's kind of like every supplement. A supplement is by definition something that's natural and that is not going to have any side effects. It's not a drug. It's really more of food derivative that has some health properties.
yeah,
So you could start very early.
and obviously whoops, sorry, wrong question. And obviously you can go long term with no adverse issues. Uh,
Correct, because it's not a drug again. So
again,
yeah,
so
it's natural.
yeah. Uh, I cringe when someone comes in and says, "My dog is 8 years old now and starting to limp a little. Should I start joint support?" Um, if nothing else,
Yeah.
you need to get the word out there, um, that
Yeah, I really regretted with Pepsi not starting
not
sooner.
yeah,
Like I was running with him a ton, and I guess at the time, even though I was in vet school, we were just not really taught about the benefit of supplement. I think it's
mhm,
newer. But when I'm gonna have a dog again, I'm starting them on joint supplement ASAP. Like 5 6 months, especially if they're a larger breed dog. It's really important, I think, to do it early. I'm taking UC2 myself because I'm still
uh,
young, but
yes,
I work out a lot, so I'm like I need to make sure that I can walk, in like 50 years.
yeah, definitely, and, the human product, is out there, right? Is there a product that's a parallel to yours on the human side with curcumin and omega-3s?
No, I haven't find one actually. So I take them separate. They're pills. So I just like pop them. I think for dogs, unfortunately, when you try to give them capsules, it's just not. You can't
Yeah,
explain to them like this is healthy for you. Please open your mouth and swallow.
mhm,
That's why
yeah,
we created like chews that are very palatable. Dogs like to eat it. It just makes it easier.
mhm.
You could eat them. I tried them. It tastes like chicken, even though it's vegan chicken flavor. My partner loves them. He pops them like they're treats, but I'm like, stop doing this.
No, no, I just couldn't. I
It
couldn't.
is human grade and like produced in a FDA approved facility. I would not recommend doing it for sure.
No,
Please don't.
no,
But
just no.
yeah, it's not good.
So, this question about Adequan is intriguing because
Yep.
Adequan is, given by injection. It was one of our first joint support
Hmm.
products. Uh, I don't I don't look at them at your product and Adequan as interchangeable, but could they be complementary?
I think you're correct, Lori. I wouldn't say interchangeable because with Adequan, you're actually injecting it in the joint. So it's a very different kind of delivery mechanism, and
Well,
it
and we
also
do have
uses.
a small animal form that we inject subcutaneously or intramuscularly as well,
Okay,
but still,
but it does
it's
have.
going there.
Yeah, and it's also a different mechanism of action. So I think, in an approach to joint health, the UC2 with the oral tolerance mechanism of action, the curcumin that acts on the lipooxygenase and cyclooxygenase, and then, adequin, which I believe is glycoaminoglycans, right? So
It
it's really
is.
going to help lubricate and fix the joint. So I think actually it would be really interesting to use them in combination, just from a like way of action. And because
Mhm.
it's a different delivery system, I think it would be. I would recommend more so doing both together versus really replacing it. However, you could start Jope and UC2 and see if maybe you could space out potentially the injections, but that would really be up to the veterinarian, I think.
Yeah. So let's tackle this. Uh, so Jane is asking, why would a six-month-old puppy need a joint supplement if they have the correct food? Humans don't take joint
Hmm.
supplements when they are children. Um, and I can't speak to little humans, I don't have any, uh,
Me neither.
but
Yet.
I would wager that there might be humans who choose to supplement their children. As far as the dogs, I think, comparing dogs to human, not a fair comparison.
Mhm.
And why would I supplement a 6-month-old Rottweiler, that even if they're eating, let's say they're eating an ideal fresh food diet that's nutritionally complete, owners are going to do things with that dog. They're going to take them out. They're going to do agility and exercise the dog beyond tolerance. The dog might not be built correctly, could have conformational weaknesses, could have genetic susceptibility to different injuries or disease processes, and also uh, may have been spayed or neutered at what I would consider an inappropriate age. And I am of the belief that we should be waiting to spay and neuter till skeletal maturity in the vast majority of dogs. So when you put all those things together, why wouldn't you supplement and try to proactively protect, as you said before, proactively protect those joints? Because once that articular, meaning that super smooth, nice, healthy joint cartilage is gone, it's replaced with fibrocartilage that is not as good at coating the joint, not as smooth, and leads to arthritis. Would you agree, or can you add to that?
Yeah, I think you bring up very accurate points. We sometimes want to do the parallel between us humans and our, furry friends. We're very attached to them. They live with us. So we somewhat, I'd say, project what we do for us to them. But dogs are very different. Like, for example, a 6 months old puppy is not, a toddler. He's actually, in human standards, like a teenager, right? And that's actually when teenagers are growing really fast and are changing, that you would probably actually want to use supplements, which is not something we're doing currently, but I think it would be worth, thinking about. So, even in that sense, like a teenager should probably get more nutrient, more supplements to help him grow or her grow, and be in line with her needs or his needs. And also, dogs have a very different type of metabolism than us. That's why a lot of the drugs that we take or supplements, like I always tell people, do not give your dog a human supplement. Like, even if it's a supplement, it might not be right for them. You want to make sure that it's a animal one. So, they are very different. And I think it's important to really think about a dog having a completely different health and biosystem than we do. So I certainly agree with you. And the studies are showing nowadays that, what is it, like 40% of large breed dogs that are over, I think, 6 months of age have actually a very low stage of arthritis. So stage one and two.
It wouldn't surprise me. And I
Mm,
think of, my Labrador clients, whether they be my show Labrador clients that are showing a 6 to 9 month old puppy and they've got it at 80 pounds because they show
mm,
labs fat, or
yeah.
just the pet owner who's overfeeding the puppy and taking it for a walk and taking it running when it's not got skeletal maturity. These are higher risk activities. Um,
Yeah.
we can't compare. And sure, is the toy poodle as likely to have joint problems as that Labrador? No, of course not. Um,
Yeah. Every breed is different,
every breed
but
is
it's
different,
just,
and every
mm,
and both genetically and environment. Like, was it a shelter dog that was spayed or neutered at 8 weeks of age? Those dogs have to be walking around with so many problems that are caused by their environment, lifestyle, whatever management techniques were applied to them, that we can protect for. So I'm of the opinion that supplements like yours, they make the dog better. Why wouldn't you jump on board?
I have the same, views on it. And again, it's from my personal experience, but not everybody has to have, the same views, or
Sure,
everybody lives different lifestyles. So I can understand, some people might be skeptical.
sure.
But I do think the natural, kind of more and more people are aware, and more studies are being done too. So I'm pretty sure in maybe like 10 more years, everybody's going to be taking some type of joint supplement.
It wouldn't surprise me. And I mean, I think of my years at Cornell. Um, I was actually there when Adequan was first developed, and
Hmm.
there's a study published by a professor of mine, Dr. Lust, George Lust, and they took 2 lines of Labradors that they had at the Baker Research Facility, one that was bred to have hip dysplasia and the others that were not. And they
Hmm.
gave the dysplasia-prone puppies, I wanna say it was 5 mgs per pound of Adequan twice a week, starting
Hmm.
at maybe, like, 6 or 8 weeks, and they prevented the development of hip dysplasia in those dogs, which, is mind-boggling when you know the genes are there, and of course, it was a
Yeah,
well-controlled split the litter study. But, when we intervene with things during growth phases, we can affect change, and that's huge.
I agree. I think it's very interesting, like how much you can do when you're kind of controlling the environment, like you're
Mhm.
saying. And some things we're not 100% sure of how it's going to affect it one way or the other. Like you said, spaying and neutering. I think that's still not really well known.
Yep.
But for supplements, I do think there's more and more studies showing that there is benefit to starting early, especially if you have, quality ingredients.
Well, and omega-3 fatty acids. A lot of the studies on DHA specifically enhancing cognitive ability in puppies. So,
Hmm.
supplementing with various fish oils, or they've even put it in kibble, which kills me. Um, but, kibble, you can even make kibble better by adding DHA. And they have, yes, company sponsored studies that show improved performance in the DHA supplemented puppies. It's wild.
Yeah, I mean,
It's
omega-3s is also it's a very well recognized supplement, and it's used for multiple different reasons at different doses. So it could be for arthritis, skin, cognitive properties too.
Mhm.
You do want to be careful because it's not like one type of fish oil is not going to be the same for all these kind of different things you're trying to target. So I think that is also important to keep in mind that depending on what you're prioritizing, I'm going to succeed in saying that word.
Mhm.
You want to make sure that you're choosing something that meets kind of your needs and your dog's needs too.
Yeah, and I generally advise people to go with a variety of fish oils. So, maybe they're doing salmon 1 bottle,
Mm,
sardine and anchovy, what have you, and know, their sourcing and the various types of omega-3s that are in there, the ratio.
mm,
And yes, in a perfect world, all of those things would be coming from food. But as you kind of alluded to before, um, these your ingredients come from food, but carefully raised food. If we could all have access to free range organic, chickens and such, we'd get the omega-3s there, or
yeah.
or other land mammals. But our foods
Well,
are deficient.
and that's a very good point too you bring, like, choosing carefully the origin of the ingredients that you're
Mhm,
going to give your dog. I think it is important. Like we chose only organic ingredients sourced from the US with the exception of the fish oil because that obviously is kind of harder. We didn't want it farmed. So we actually chose anchovy oil just out of
mhm.
respect for the environment too.
Yeah.
And then the curcumin is the only one that comes from Asia as well because it's not produced actually in the US, but we have certificate of analysis of origin. So we're being very careful to track where they come from because if you're giving a supplement, you don't want to give it's something that has to be healthy that's going to help. So why add anything that could actually take away from that first intent? um
Yeah, and it's hard because some things are only grown or available in certain parts of the world. And yeah, you're up the
yeah.
creek, so to speak.
Yeah, for the curcumin, we're trying to get it, in Europe or South America or US, but it was just there's none.
Mhm.
interesting. But, you know, I guess it's also good like that you respect kind of where the product comes from and where naturally it was present. So, again, I think, yeah, it kind of makes sense to, you know, can't control nature everywhere.
No, no. Let's switch gears. I wanna look at Janet's question, because this is interesting to me. We have a lot of tick-borne disease here, whether it's Lyme or anaplasmosis, and
Mhm.
some of these dogs, we know they may never clear the Lyme organism from their body, and they're going to have
Mm,
chronic inflammation from that
mhm.
at the joints. Could could UC2 be helpful in
So that's
kind of dampening that response?
So that's a very interesting question, which I haven't had yet. I go visit a lot of veterinarians
That's
in the New
great.
York area, so yeah, I'm like, it's good. I might get it one day. You know, I think with Lyme, it's really hard because the way it works is basically, like you said, it's an organism that is in the dog body, and then at times, with no warning and for no reason, it's going to kind of reactivate. So that's what we call flare-ups of Lyme disease, right? And the inflammatory process being linked to that specific kind of infectious agent in the body, it's going to be hard to really stop it. I do think that, you know, if you're thinking about inflammation, so at the joint level, if you're giving it regularly, it's going to help maintain a healthy joint environment. I do think that when the flare-ups happen, you're probably going to still need to add something a little bit stronger to deal
Mhm.
with the pain. I know some people who have that, and even though people are different from dogs, I do think it's very painful when they occur, these crises. So again, like, you know, our product is a supplement; it is not a drug. I would just be careful of making any promises. I think it's worth trying,
Mhm.
and I would love to know if it helps. Like, I would, you know, happy to track it. And we really try to keep in touch with the people that are using our product like regularly. We send them emails, personalized, to really get their inputs and see based on their dog's condition if it's actually helping them. So, you know, I'd be happy to chat after too and just try to help. I think it's worth it. And I'd be interested to know. Unfortunately, I think it's not going to fix everything.
Yeah, and when I think of the Lyme bacteria, it's, they're kind of corkscrew shaped, and they migrate through tissues.
Mm,
So, when you've got that Borrelia, just or any rickettsial for that matter, just going invading tissues, I just picture a trail of inflammation, from the muscle in through the joint capsule potentially. Um, it's gotta hurt. It's really gotta hurt.
mm,
And anything that
yeah.
stopped that inflammatory process. I mean, maybe it would be the curcumin that would do more, but if the combination is synergistic, I don't know.
Yeah, I think
It'd be
it would
interesting.
actually, so yeah, and the, you know, the curcumin, as you were saying, actually acts on the lipoxygenase and cyclooxygenase cascades. So do the omega 3s, and then UC2 actually works on the cells, so it's more
Mhm.
like a cellular response that it triggers. So the combination could certainly be interesting.
Yeah. Well, there's your next research project, right?
I didn't have enough already.
No, no, not nearly. Not nearly. Um, okay. Oh, and Janet has, speaking of organic chicken, 1,000 pounds. I can't even picture 1,000 pounds of chicken feed. Um,
That's a lot.
that's a lot. That's a lot. Are there any contraindications for UC2 that you're aware of?
No, so we've
Cancer
been asked.
patients or anything like that?
That is a question that has recurred. There's none, you know, to date that we know. Again, supplements, just generally speaking, whichever supplement for dog that you're using are safe and effective with time. Some are more effective than others, as you know, studies have shown. But there's no known contraindication. We had some people ask us, for example, my dog has kidney disease, severe kidney disease. Can I give Jope? um, our answer in that case is that, you know, Jope has no animal protein, so there's even the chicken flavor is actually from rosemary and sunflower oil,
Oh,
And
wow.
then, so it's like vegan chicken flavor. And then the UC2, obviously comes from chicken, but cartilage, but it's really just the under nature type 2 collagen. So it's not like anything, and it's, a few milligrams. So it's really nothing that, in theory should do anything. But we always say for kidney disease, liver disease, like anything internal that could be severe, just to confirm with their veterinarian that they're comfortable using it. I would feel comfortable in most of these cases just because we don't use, we don't use any animal protein except UC2, which is, 40 milligram, 20 milligram per chew. Then fish oil can be used in kidney disease.
Sure.
So, pretty mild. And for cancer patients, it can be used with any drug. I think it's more about, are they going to have the appetite to eat it? That's going to be probably one of the big things with
Mhm.
chemo or, whatever therapy they're getting. It could affect
Right.
their taste like it does for us too. So yeah, but I would say, so far so good. If you're interested, in trying Jope or any other supplement and you're concerned, I'd say the best person is certainly your veterinarian who knows your dog, has followed your dog. So I would just say, they can shoot me an email. I can get on a call, answer their questions so they can feel comfortable recommending.
Yeah, that's perfect. And so many, I find more oncologists just say, take them off all supplements because it might interfere. And I think sometimes they need to be talked off the ledge that not everything interferes. Um,
Yeah, and then it's also quality of life, like if your dog can't walk around because they have pretty serious joint disease, like that's also quality of life impact. And
exactly. Um, and the flip side of that is if any supplement being given could impact blood testing, that might throw the veterinarian off. Like I always think of my raw fed dogs will have higher red blood cell indexes and they'll run a little higher on BUN and creatinine than a kibble fed dog. And many vets, conventional vets, don't understand that and that is normal for for those eating that diet. Um, any thoughts on Janet's comment?
so elevated liver 9 and 309 turmeric could be hard to remember. um we haven't seen any studies that would suggest that. If you do have any, please send it over. I'd be interested. But I think, again, it's a supplement. You have 50 milligram per chew in our case of curcumin. I feel like these quantities are still, in the milligrams. So even if you're giving it daily, even if you're giving, 3 chews, which is for the big size dogs, it's really not that much. I don't know. I'd love to know your thoughts too, Lori. I feel like it'd
Yeah.
be fine, but
I mean, I
and I
guess
haven't seen studies.
I haven't, and I think of all the dogs that I wind up putting on Doxy because they have clinical Lyme, and then their ALT's gone up after that, and I put them on a Pato support, which I believe the RX Vitamins one does have some curcumin in, and they typically respond beautifully.
Yeah, I think also curcumin is eliminated through feces, so it's
Mhm.
not really necessarily processed through the liver. So I feel like that should also be, another indicator that it would be okay.
Yeah. Um, and certainly omega-3s we give to, dogs with kidney disease to
Yeah.
all sorts of uses for that.
Mm.
Um, and I guess if you were really worried, maybe you had a dog with a compromised liver, maybe you might do some liver support, like just simple milk thistle
Mhm.
to
Yeah,
keep
you can combine it, and you can also, check with your veterinarian to do blood work, maybe,
more
every
frequently.
month for like a few months, and then
Yeah,
see if you're comfortable. That's always an option, I think.
yeah,
You have to be comfortable with what you're doing, like I have a product, I think it's a great product, but I can also understand it might not be for your dog. Like every dog is different. I think
mhm,
as veterinarians, it's something we keep in mind is like it's not a one size fits all approach to medicine. And most dogs, I think our product is outstanding and will be the best, but maybe for others, they're going to need, something different or
yeah,
add on something, or they won't like the taste. And then, you can't feed it to them. So you
exactly.
need to find something else, which
No,
doesn't happen very often, but it does.
it does, and, when we like to on in our community, we like to tailor things to the individual dog. So,
Mm.
that to me just makes sense, and the individual human for that matter. Oh, someone had asked earlier where you get your UC2 for yourself.
Oh, so I got it from a brand called Now. I
Oh,
get it on
nice.
Amazon. Now, yeah, and it's just a capsule of UC2. It's like very small and white. That's what I used to give my dog Pepsi. I like put it in peanut butter and then I
Mhm.
added a capsule of like curcumin and then but at the end I was like, this is a lot of things I'm trying to like put in
Yeah.
peanut butter.
Yeah,
It would have been nice to have just a chew and like make it a little bit easier, less messy, you know?
that's messy, yeah. But the things we do for them, the things we
Yeah,
do for them.
he was worth it. Every second of it for sure.
So now you went to vet school in France,
Mm-hmm.
correct?
Yep. Yeah,
Um,
so I graduated from the Vet School of Toulouse, but I also did 2 years abroad. So I did a year in Australia at the University of Melbourne to do my like their final year, and then I did another year in the U.S. where I went to Cornell, Colorado, Louisiana, and Ohio to finish my clinical year too.
wow. Yeah, so you've seen kind of a broad experience of different types of practice, different diseases.
Oh
Um,
yeah.
I saw this morning, and I made a note to ask you. Connor Brady shared that there is a tongue worm that's been found in a second dog in Europe, a dog that had
Oh,
not traveled.
interesting.
Have you ever heard, and a raw fed dog, of course, have you ever heard of tongue worm in dogs?
No, when I came to the US 9 years ago now. I don't believe I had heard of a case. And now
Yeah.
I try to keep more in tune with the US veterinary news
Yeah.
than the French one, but I'll definitely ask some of my friends.
Yeah,
What is it? It's
I have
like a
never heard of it. Um,
it's yeah. I
it's
had never heard of a heartworm until I moved to the US.
Oh, they don't have heartworm in Europe?
Well, not where I came from. They have it like in the south
Oh, okay.
of France a little bit, but definitely not as common. But we have Filarios, that is also transmitted by
Mhm.
mosquitoes too.
Sure, sure.
So,
Um, oh, and Janet says, "Thank you for the blogs." You are
well,
people are reading.
yeah, we have a lot of articles. Some of them are really long, but we want to try to have, as much information available out there. Again, like the idea behind our company, why we chose Joy of Pet is not just to sell product to sell product. It's actually to help people better care for their pets and, dogs. Even if our articles are helpful, but you don't want to get our product, I'm very happy with that too. Um,
Absolutely. I think our profession in general gets sometimes some unfair criticism because we should be doing this for free because we love animals. I'm sure you've heard that one. And, it happens.
we,
And
we still need to feed ourselves to help
yeah,
more
we still
animals
need
too.
to
But
pay our bills, pay for our education, um, and they don't tell other professions that. So some days it gets to me that all
I,
you
I
do.
haven't had that in a while, but
That's
yeah.
good. That's good. Um, I got it just the other day, so it's still a hot button
On
um,
your mind.
on my
Mm.
mind. Yes, and it's just frustrating when
Well,
people.
I think it hurts. That's the biggest, right?
Yeah,
It hurts you
yeah.
because you're like, well, I do care, but it's it's hard.
And
Like you're probably helping shelters, and I'm sure you're doing all that. Like you're donating to shelters, you're
well,
helping.
and
You need to.
we spend well, all of my sponsors, everybody's been hopping on here, giving away an hour's worth of knowledge here, there, and everywhere. And you know, no, it's not enough.
It's true. We're not paid to do this.
Yeah, we're not paid to do this. No, this is
No.
we're not paid to write those blogs and such, but we do it. Um,
Yeah, I agree.
so so anyway, we digress. So back on topic, where do people find your product?
So we have it online on our website. It's petjope.com, and we also have a special code for people that are from the Healthy Dog Expo. It's Healthy Dog 23. You could email us on the website. There's like a contact form, and we can send it to you. So you'd get a discount for being part of the Healthy Dog Expo. because we want to also give back to the community, like you said, Janet. So you could email me, and we are on Amazon too. We are not as strongly present, but you could order there. That's more convenient. If you
Mhm.
do order on Amazon, we'd love some reviews because we're very new, so it would be helpful.
Yes. And I rely on Amazon reviews for all the things I buy. So I buy a lot of technology type stuff, and I want to know if it works. And of course,
Yeah,
you
of course.
also our colleague Debbie Taraka, who owns Wizard of Paws, is a fan of your product. And Debbie does not take on products quickly or without having a lot of faith in them. So I know she's seen good results. And
Yeah,
she gets the hard to treat cases for sure.
she's been amazing, and we're very thankful for her support. Thankfully, we've gotten a lot of very positive feedback from clinics using our product,
Good.
KOLs, so like key opinion leaders too that are reaching
Mhm.
out. And we're working on getting field studies, and ideally, we'd love to do a double-blinded placebo study too, but that's actually
Yeah.
very expensive, as we discovered.
Oh,
So right now we're
science is expensive. You're absolutely right.
Yeah, it's way more than I expected. It's like, in the, how do you say that, six digit? Is that how you say
Yeah,
it?
well, we were looking at doing a trial with a supplement. Uh, so, a dozen dogs, each some taking the supplement, some not. I think there were maybe 3 groups, and it was $30,000 for 6 weeks.
Yeah, us it was we got quotes for 100 to $200,000
Yeah,
to be able to do, like 3 months and have 20
longer.
dogs. And yeah, we wanted to do it longer, but we might need to postpone a little bit.
Yeah, we need to
you
get
know?
well, and it would be lovely to do something like force plate analysis or treadmill.
Well, that's what we're actually
That's
doing
what
that
you're
with Debbie.
proposing, yeah.
Yeah, so we're super excited, and we are doing two online. It was something else I wanted to mention. We everybody that buys our product, we send, and we'd happily send to anybody else that's interested too, a CSOM. So it's a I-9 questionnaire, which is a grid. It's a client outcome assessment form. So
Mhm.
basically, it's a semi-objective way to track your dog's progress. The way it works is you fill out a form on day one where you basically pick three different symptoms that are most representative of where your dog struggles. So, for example, going up and down stairs, having trouble getting up in the morning, and vocalizing at random times for no reason. And then we send you a personalized grid that you fill every 2 weeks. And you can annotate, and that helps us track your dog's progress, and you can track it as well. So I think that's really helpful to have, an objective way,
Yeah.
somewhat semi-objective way to assess.
Yeah, and record keeping and journaling, it's the only way you can really look back because you think you'll remember, but you don't.
Yeah.
Um, and have you considered adding, like, video to that process? Because to be able to video your dog, trotting across the yard before and after would be really, really cool.
We haven't included it, but you're actually that's a very good comment. We might add it to the form to ask
Just
like to
do
record
that,
it and
yeah.
send it, because it would be really helpful for us. And I think another reason we were trying to do that is, and it's just kind of something I wanted to mention, that for joint supplements specifically, for some reason the placebo effect is actually very present. Meaning that when you buy a supplement and you give it to your dog, you're sometimes gonna have the impression it works. The placebo effect is actually on the owner, who's
Mhm.
gonna think that because they're giving something to their dog, it's helping. And that's why a lot, like glucosamine, chondroitin, there's other studies that have been done since 2000. All of them show that it's really not more effective than a placebo using ground force plate, so an objective measure.
Yeah.
And the reason of that is the placebo effect. Like, people think it works, but if you actually take a ground force plate, which is what we're using to test our product with Debbie, that's when you see that it actually isn't really different. So I think that's something also people aren't aware of, that there is the placebo effect that exists and is very prevalent for especially mobility issues.
Yeah. Yeah, I completely agree, and, I have colleagues that say, "Oh, joint support supplements don't work," and then somebody else argues about it. But, if we can have an objective measure, that
Mm,
that would be fantastic, and it starts with the owner.
yeah. And so that's why, that's why we're doing this CSOM to have a semi-objective. We don't have a force plate that we can just send to somebody's house.
Sure.
But that's also how we selected our active ingredients is by taking only the one that had positive results on ground force plate, and that's UC2, omega-3s, and curcumin. At least to date. That could change tomorrow because
Yeah,
there's many
yeah,
studies that are being done all the time.
right.
But to date, those are the three that have consistent positive results on ground force plate. So it's like a machine, and for the people who haven't seen it, it's very cool. It's like a big, long kind of yoga mat or
Mhm.
scale, and then the dog walks on it, and it has like captors everywhere under, and so you can see for every one of their joints like how the pressure they're putting on it, and when they don't put pressure on one paw but more on the other, it basically means they're painful on like the joint that's being helped.
Yeah,
It's pretty interesting.
yeah,
I
and
saw it at Debbie's for the first time. I was like, oh, a Wizard of Paws. I was like, this is amazing.
yeah, well, The Wizard of Paws is amazing.
It
Uh,
is.
but, and she always said from early on that the body finds a way to compensate for whatever is weak or painful.
Mm,
And, you will see the person with the bad knee using their hips differently, and the dog, with the sore toe is changing their body posture and adapting because we all find a way to function despite that. And,
yeah.
that's where finding the underlying cause and addressing it and then addressing the compensatory stuff keeps her in business all the time.
Oh, I went to visit like 2 weeks ago, and she is busy.
Yeah, she's
There's
busy. And
her team is. Awesome.
and she'll be coming on with us tomorrow from the American College of Veterinary Sports Medicine. Is that the right
Correct.
conference?
Yeah. Yeah.
Uh,
Yeah.
do you know where that is? Is that south of us?
Texas, I believe. I think
Texas?
it's Texas. I
Okay.
believe so. Like Austin, I think she was saying.
Okay. It looked warm. It looked warm. That's about it.
Yeah, it's not warm where I am, but
Mhm. And we're getting the question about you are bringing product to the expo with you, right?
yeah,
Yeah.
we're gonna be bringing products, some samples too, in case you want to bring some back. We also have some very cute, like little bandanas
Oh, we got
that we'll be handing
bandanas.
out.
I
We
love
got
it.
bandanas because they're very cute, and we need Instagram pictures.
Well,
Uh,
as I've told you, I was down at the hotel this morning, and we'll have a step and repeat banner for people to take pictures in front of. So you can,
nice.
and maybe I can find some red carpet. I'm sure the
Ooh,
hotel has some. So we will have
probably.
the red carpet photo junket just like the award shows.
It's pretty cool.
It's going to be fun. I'm really looking forward to it. And meeting you and some of the other new vendors. This is the first event you've done, isn't it?
It is their first one we're sponsoring. We're, a young company, and we wanted to find, like one option would be to sponsor other very big conferences, but we wanted to find a conference that was really in line with our values and the Healthy Dog Expo. Once Debbie explained to me what it was about, and I looked at the speakers, and then we
Yeah.
met you, we felt like it was really what we wanted to support. We have limited funds, so we need to choose, and we felt like the Healthy Dog Expo was just like kind of the right fit for us, and also probably the right type of people there. And so I think smaller is really nice because then you actually get to spend time with people and answer their question, and you're not just like having people come and grab a pen and grab
Yeah,
something
that's
and leaving. It's
anybody
like
who's been to a big trade show knows it's like
yeah, it's
Halloween.
intense.
It's like Halloween trick or treating for adults. And
People walk around with massive bags of stuff. I'm like, you do not live in a New York apartment because you
no,
cannot bring this back.
no, no. So definitely. Well, Christine, thank you so much for joining us today and
Yeah,
sharing this. And I can't wait. 3 weeks will be gone before we know it. And you'll be meeting all of my wonderful people. And
I'm very excited.
hopefully it will be warmer than it is today.
Well,
But
we'll be inside though, right?
well,
So
yes, we'll be inside. We will definitely be.
not too bad.
Not too bad at all. So thank you everyone for being here. Remember to go to healthydogexpo.com and grab your tickets. And I will see you tomorrow at 1 p.m. with Dr. Debbie Taraka and maybe a special guest or two. Thank you all.
Ooh.
Bye for now.
Thank you, everybody. It was a pleasure meeting everyone.
Bye.